All right, then let's move on to the muscles of the brachium region of the arm. And we're looking at the anterior side. What do we call these anterior muscles on the brachium of the arm? Those are the biceps, and we have two of them. They have two different origins. The most lateral one is called the biceps brachii long head. Inside we have the biceps brachii short head. Good. And the origin's up there on the scapula. The insertion's down there on the ulna. And what happens when those muscles contract? What's that motion right there? Elbow flexion. Good. Then if that's elbow flexion, what do we call that motion right there? Elbow extension. And what muscles are responsible for elbow extension? The triceps. The triceps are antagonistic to that. So again, it's a muscle with three different origins. The most lateral one is called the triceps brachii lateral head. The inside one is the triceps brachii long head. And then there's a deep one called the triceps brachii medius. And all three of those muscles merge onto this tendon, which we call the triceps brachii tendon. That crosses the elbow joint and inserts on the olecranon of the elbow and on the ulna. So, those muscles contract, they pull on the olecranon, and that causes elbow extension. Okay, good. So now let's move on to some hip joint muscles. Okay, these are muscles of the hip. And this is ringing true for me right now because I have some hip tightness. For some reason, my right side is always tighter than the left, so it shifts stuff, and that can shift your spine, and it can lead to whole sorts of problems. But these are muscles that are going to cause movements of the hip. And what's the big joint? What type of joint do we have here at the hip? What type of that's a ball and socket joint with the head of the femur and the acetabulum of the hip joint. So again, we're going to have all sorts of movements here, just like the shoulder joints. And we start with this muscle right here, probably the most well-known of the hip muscles. This is your major butt muscle. What do we call that?
Gluteus maximus.
Gluteus maximus. And it's got all these origins up here on the hip region and whatnot. But where's the insertion for the gluteus maximus? Well, it's on the femur. It's on the posterior side of the femur. Okay. So you can get yourself in this position, and what happens to your leg when your gluteus maximus contracts? That's called hip extension, okay, or extension of the leg. And that's what your gluteus maximus does. Okay. And the gluteus maximus is, it's important to activate that muscle, if you're walking or you're running or anything like that, because this is the muscle that you want to use when you're doing those types of long activities. Okay, the gluteus maximus it's powerful and it has a lot of endurance. So before I do some stuff, maybe I'll take a band, wrap it around my thighs, and just do that motion right there. And that establishes that mind-muscle connection, and it activates that gluteus maximus. Because if you're not activating that, other muscles are compensating, and it's not their primary job to do that. Good, so that's the gluteus maximus. There's another, maximus implies that there is a smaller one, and there's actually a couple smaller ones. The next one is the gluteus medius. You can't see it here. If you took away the gluteus maximus, it'd be right underneath here. It's right underneath the iliac crest, but it comes down kind of like a triangle, and again, it inserts on the femur, I think on maybe the greater trochanter of the femur. But it is more lateral, so what's going to happen? What's the femur going to do when the gluteus medius contracts?
Go out.
It's going to go out, and that's called abduction.
Away from body.
Away from body. Abduction of hip abduction or abduction of the leg. And again, this is a good stabilizer muscle here. I've had problems with my sacroiliac joint right there, and it getting misaligned because of these different hip compensations. And one of the main things that helped is strengthening that gluteus medius. And a good way to do that is, again, just put bands around your thighs and your legs and just do this, lateral motion. Really strengthens your gluteus medius and kind of just stabilizes that sacroiliac joint. All right. Then we have, and again, it's a little ambiguous here, but there's a muscle up here. This is showing it all as fascia, but there is a muscle up here that runs into this band, this tight, strong band of tissue that runs down the lateral side of your leg. What do we call this band of fascia that runs down the lateral side of your leg? That's your IT band, your iliotibial band or your iliotibial tract, because it runs from the ilium down to the tibia. And there's a couple muscles that insert into your IT band. One of them is the gluteus medius, and the other is the tensor fasciae latae. Sounds like a fancy coffee drink, your tensor fasciae latae. But again, those all run into your IT band, and one of the main jobs of the IT band is to stabilize your leg. So strengthening your TFL is what they call it, your tensor fasciae latae, and your gluteus medius will help stabilize that IT band as well. And if you really want to get yourself into some good pain, you can take a roller ball and roll it all along that IT band on both sides of it, and where those muscles kind of insert into it. Because if those muscles are tight, it can pull excessively on the IT band and lead to some pain. And the idea behind, kind of rolling on this stuff is I'll take a lacrosse ball for this and get it right on the gluteus medius. And most of the time there's some really, there's some pain in there when you put your body weight on it. And the idea is that maybe that muscle is contracting a little too much on its own. And when you put that pressure there, that force, again, you're establishing that mind-muscle connection, and it tells your brain, okay, just relax, muscle. Okay, you don't need to be contracting as much as you're doing. And that's the idea behind a lot of the trigger point stuff, using a lacrosse ball or whatever. Good. And then lastly, the last hip muscles that I want to talk about are collectively called the hip flexors. So the gluteus maximus is responsible for hip extension. The hip flexors are responsible for the opposite, hip flexion. So if you go down to bare bones and add a layer of muscles, one of those hip flexors comes up right away. And you can see the origin of it, it sits on the anterior side of the ilium. It's super deep there, right on the anterior side of the ilium, and it goes down and it inserts on, it looks like the lesser trochanter of the femur. And what do we call that muscle?
Iliacus.
The iliacus. And if you can just visualize it, when these muscles contract, obviously the hip's going to stay stationary, but it's going to pull on that trochanter of the femur, and it's going to move that leg forward. It's going to cause hip flexion, and I think they have a video for it here. Flexion of the hip. There you go. It's showing the knee flex at the same time, but the motion that we're looking at is at the hip, at this ball and socket, so hip flexion. So we have the iliacus. Let's add another layer of muscles and we get the other one.
Psoas major.
Psoas major. And these muscles run deep in the hip. Has anybody gone to a massage therapist and had them try to kind of trigger point or access the hip flexors? They take their fingers and they get really deep in there. Okay, because they have to reach these muscles in the back. The psoas major, the origin's a little bit different. Let's isolate it, see what we find. The origin's on the lumbar vertebra. Guess what? If your psoas major is tight, then it's twisting on that lumbar vertebra. So another reason to stretch and to keep those hip flexors nice and stretched out. But again, the insertion point is down on the femur. And what's this going to do? Again, hip flexion. And they do refer to these collectively sometimes instead of individually. They call them the iliopsoas. Iliacus and psoas major, they just combine them, the iliopsoas. And actually some other hip muscles while we're here, we have all of these muscles on the medial that attach to the ischium region of the hip, and then the insertion is on the medial side of the femur. We have the pectineus. We have the adductor longus, the adductor brevis. And somewhere in here, there's an adductor magnus in here as well.
Tucked behind it.
Is it?
By the gracilis.
By the gracilis. I'm not finding the adductor magnus.
They have to go like.
There it is. There it is.
Inside.
Yep. So those are collectively referred to as your adductors. And as the name implies, what motion is that going to do at the hip? Hip adduction. Yep, adduction. So the gluteus medius causes hip abduction. The adductors are antagonistic. That causes hip adduction. Good. Thank you. Oh, I'm going to go back and it's not going to be recording, so anyways. Now I want to move on to muscles that cross the knee joint. And we have two large groups of muscles, one on the front side of the femoral region and on the back side, and both of these cross the knee joint. This is the sartorius right there. I'm going to go ahead and take that off. But what do we call these large group of muscles on the anterior side of the femur? What do we collectively call those? Those are the quadriceps. Okay, so it's a muscle with 4 different origins. And let's just go through the names. You have this first one that runs right down the middle. This is called the rectus femoris, which may be the most difficult one to remember. But then after that, it kind of makes a little bit of sense. You have this one in the middle. This is the vastus medialis. Then you have one on the outside. That's the vastus lateralis. And then if you take away the rectus femoris, you have one more that's deep to that, and that's the vastus intermedius. Not surprisingly, the origin for these is up on the hip. But what about the insertion? Well, eventually, where do we want these muscles to insert on? All right, so we have all 4 of these quadriceps. The origin is up here on the hip, but ultimately, where do we want these quadriceps to insert on? Down here on the tibia, and what's the specific bone marking on the tibia that we want it to insert on? You can feel it. Tibial tuberosity. So how does it get there? Well, you have all these quadriceps that come down, and they all merge onto this kind of floating bone in front of the knee, which we call the patella. So the quadriceps actually merge on the patella, but then there's a ligament that goes from the patella to the tibial tuberosity. That's called the patellar ligament. And so if your leg is in this position here, those quadriceps contract, origin stays stationary, pulls on the patella, pulls on the patellar ligament, which pulls on the tibial tuberosity. Waka! What do we call that? Knee extension. Okay, quadriceps are knee extension. What are the muscles that are antagonistic to knee extension? These are the muscles that do knee flexion. What do we call these in the back? Those are the hammies, the ham dogs, the hamstrings. Okay, and there's 3 of them there. These names are a little difficult to remember, But starting laterally, we have the biceps femoris long head. Then we have the semitendinosus. Then we have the semimembranosus. Those are the three hamstrings. Again, the origin's up here on the hip, but now the insertion for these is on the tibia and the fibula, but on the posterior side. So these hamstrings contract, they pull on the posterior side of the tibia and the fibula, and that results in knee flexion. Does anybody know which one of these groups of muscles are stronger, the quadriceps or the hamstrings? Quadriceps are much stronger. Much stronger, yeah. So, you know, if your quads are tight, it's pushing your hip forward. Hamstrings are tight, pushing it back. It's good to work on those hamstrings, strengthen the hamstrings just to keep them strong and to compensate for the strong quadriceps. Lastly, muscles that cross the ankle joint. And there's two motions that we're dealing with here. One is when you move up on your toes. That's called plantar flexion, where your heel lifts up essentially. And the other one, when you go back down, that's called dorsiflexion. Since we're looking at the front side, let's just go with that. You have this muscle that runs across the front that's called the tibialis anterior. And that's going to be responsible for dorsiflexion. Okay, it pulls your toes upward. Pulls your toes upward. Let's go to the back. These ones are a little more familiar. So all these muscles on the back are going to be responsible for dorsiflexion, where you're standing up on your tippy toes. But really the motion is that you're pulling up on the calcaneus. So let's start with these guys. These are the calf muscles, but more specifically, this is the gastrocnemius medial head. This is the gastrocnemius lateral head. And they run into this large tendon right there, which is called what? What tendon is that? That's the Achilles tendon. And where does the Achilles tendon go? It goes down on the calcaneus. So these calf muscles contract, pulls on the Achilles, and that moves the heel up, which causes you to stand on your toes. And then there's another muscle beneath that called the soleus that does the same action. All right, so the next thing I want to do is look at some muscles of the vertebral column, or muscles of the spine. So we'll use essential anatomy to do this. And here we have an anterior view, and what we want to do is we want to turn it around and look at a posterior view. So let's everybody do this with me. And we're just bare bones at this point, no skeletal muscles on top. And what I want to look at first are a group of muscles called the erector spinae muscles. And these muscles are going to run lengthwise. They're going to run vertically up the spinal column. And erector spinae is just the name for the collective name for the group of muscles. But we'll see if we can find the individual ones. So let's start off by adding a layer of skeletal muscles. Okay, so you can see the deepest muscles in the body there. Then let's add another layer on top of that. Okay, we're starting to get there. You have this muscle that that's close to the vertebral column called the multifidi, but that's not quite an erector spinae yet. So let's add another layer of muscles. And here we're going to see an erector spinae muscle, and let's select that long muscle that's running up the column, and I'm going to do the sound here.
Longissimus thoracis.
Longissimus thoracis. Okay. And in general, what's the origin for the longissimus thoracis? It's down there on the hip and on the sacrum. Okay, so a pretty stable location there on the pelvic girdle. And then in general, the insertion is up there on the upper back. Okay, good. So that's one erector spinae. Let's add another layer of skeletal muscle. There's another one.
Iliocostalis.
Iliocostalis. And again, the origin is down there near the hip, and the insertion is on the upper back. And then let's find one more. Oops. Oops, we don't have to add another layer of muscle, but iliocostalis, longissimus thoracis. I'm looking for the spinalis.
Well, it's right in the middle.
Spinalis thoracis. There it is there. Good. So those are all erector spinae muscles. Now the next question is, what are those muscles going to do? And if you go to the, let's just pick the longissimus thoracis, and then go to video, and go down to the second one, extension of the spine. That's it right there. So vertebral flexion, and this would be better if the video were on me now, but that's okay. Vertebral flexion is when you bend forward. Vertebral extension is when you bend back. And that's what the erector spinae are responsible for. And that makes sense, right? Because the origin's the hip and the insertion's the upper back. So when you're bent over and those erector spinae contract, they're going to pull on the upper back and bring you back up to center. Okay. Good. Okay, let's turn around. And the next thing I want to do is go over the abdominal muscles. How many layers of abdominal muscles are there? There's 4. Good. There's 4 stacked on top of each other. And here we're looking at the most superficial right now. And what's the name of this most superficial abdominal muscle? External abdominal oblique. So let's go ahead and select that. And one thing that I want you to look at here is, one, I want you to find the muscle portion of it. But 2, I want you to find the aponeurosi portion of it. What is an aponeurosi? An aponeurosi is basically a flattened tendon. Okay, and tendons attach skeletal muscles to bone. So you're going to have this aponeurosi that's going to attach these abdominal muscles to either their origin or insertion. And in this case, it is attaching it to, what's that line that runs right down the middle of the abdomen? That's going to be an insertion point for some of these abdominal muscles. That's the linea alba. Good. So what does the external abdominal oblique do? Well, if both of them contract, then it compresses the abdomen, right? It compresses your core. And let's have everybody, why don't you guys stand up and first of all do what we call a posterior pelvic tilt. Get that hip forward, contract the butt muscles, and then contract those external abdominal obliques. Okay, and that's engaging the core right there. It's stabilizing the core. Good. What happens if just one of those external abdominal obliques contracts? Lateral flexion to that specific side. Good. And it's called external because it's the most external muscle. Oblique just means that the muscle fibers are running at an angle to the midline. So maybe 45 degrees in this case. Okay, so let's take away the external abdominal oblique. And we get to the next abdominal muscle, which is the internal abdominal oblique.
Internal abdominal oblique.
And the internal abdominal oblique is pretty much going to have the same function as the external abdominal oblique. The muscle fibers run a little different direction. In general, they're running upwards, but it's pretty much going to have the same function. And again, you can see the muscle portion, okay? And then you see where's the origin for that internal abdominal oblique? See a lot of it on the hip, on the ilium portion of the hip. And the iliac crest as well. And then it also comes around, if you look at the posterior side, and then you turn on connective tissue, well, that's not going to quite work. If you keep adding layers of muscle, you get to this area of fascia on the lower back. See this triangle area of fascia on the lower back? That's collectively called the thoracolumbar fascia. And there's a lot of different muscles that insert on that fascia. And the abdominal obliques are one of those. Okay, internal abdominal oblique. Let's take away the internal abdominal oblique. And what's the next one?
Rectus abdominis.
Rectus abdominis. And what's different about the rectus abdominis from all the other abdominal muscles?
Doesn't wrap around.
It doesn't wrap around. Okay, it's only in the anterior, and the muscle fibers are running vertically, up and down. So when the rectus abdominis contracts, what motion is that going to result in? What we call vertebral flexion. It's going to bend you forward. So the rectus abdominis is vertebral flexion. What are the antagonistic muscles to that? What muscles do the opposite of vertebral flexion? Those are the erector spinae. So rectus abdominis does vertebral flexion. Erector spinae does vertebral extension. And it's interesting, the rectus abdominis is your six-pack or whatnot. I would say the least useful out of all the abdominal muscles. But there is some interesting anatomy here. It can vary between individuals. Some people can have a six-pack. Other people can have 4 on one side, 3 on the other. People can have an 8-pack. So there is some anatomical variability there. All right, then let's take away we don't even have to take away the rectus abdominis. We can just turn a little bit laterally to get to the deepest one, which is the
Transversus abdominis.
transversus abdominis. And this is the one that's really like a girdle that wraps around the abdomen. Okay. Anybody do planks? Love-hate relationship with planks. Okay, where you get on your elbows there, and then in push-up position, and you're basically just engaging that transversus abdominis. And then when that strengthens up, you can put some little, leg movements in there and stuff like that. But the idea is that this is the one that's really going to wrap around the core and stabilize the core. Okay. Why is having a strong core important? That's pretty much it right there. Is one of the main ones is it protects your back. You can do all these motions with your arm and your legs, and if you don't have a strong core, then when you do these motions with your arm and your legs, it's twisting on your hip, it's twisting on your back, and it's compromising that. So you want a strong core to be able to be stable so you can do these other movements with your appendages, and you're not compromising your lower back or your back in general, the core in general. Good. Just a couple other things since we're here. Let's go down to bare bones again. Then add a layer of muscle. And there's this really bizarre looking muscle that separates the thoracic cavity from the abdominal cavity. It's kind of like an umbrella. And let's go ahead and select that. And then not only that, let's isolate it. What is this dome-shaped muscle? That's the diaphragm. And does anybody know what the diaphragm is involved in? It's involved in breathing. And the position that it's in right now, where it's in that dome position, is actually relaxed. And what's going to happen is when it contracts, it moves down and it increases the volume of the thoracic cavity, and that allows air to move in. So we'll talk about them when we get into the mechanics of breathing. All right, let's go back now. And the next thing I want to do is talk about scapular movements. Movements of the scapula, or your shoulder blade. Okay, so all these muscles I'm going to talk about next all attach at some location of the scapula. Let's see. So let's do an anterior view. Let's add a layer of muscle, another layer, another layer, another layer, another layer. Basically, what I want you to find is the pectoralis minor. Find the pectoralis minor.
Pectoralis minor.
Okay. Where's the origin for the pectoralis minor? It's in the ribs here.
Yeah, third ribs.
Yeah. And what about the insertion? You can isolate it if you want. Well, it's attaching to the scapula. It's attaching to this process called the coracoid process of the scapula. So what's that going to do to the scapula when the pectoralis minor contracts? It's going to pull it forward. And we can call that a couple things. Protraction of the shoulder, where the shoulder moves forward. Or also, what would you call it when the scapula moves away from the midline? Because that's basically what's happening.
Abduction.
That's abduction of the scapula. Good. So that's one muscle that does that. And the other one is the serratus anterior. And the serratus anterior also attaches to the ribs, but again, the insertion is on the scapula. It's on the medial surface of the scapula. So again, that's going to be a muscle that causes protraction of the shoulders. Is that a motion that we do very often? Protraction of our shoulders?
No.
Driving a car, your arm's always protracted out in front. Slouching over, it's always protracted. So these are muscles, that can kind of get overused a little bit. And it's nice to activate the antagonists that pull those shoulder blades back. All right, then moving on with scapular movements, we have a major muscle of the upper back that's going to be responsible for most of the scapular movements. And it's this large muscle, superficial muscle of the upper back. And what do we call this muscle here? That's the trapezius. And where is the origin for the trapezius? It basically starts up here on the skull, on the bone marking called the occipital protuberance, that bump on the lower back of your head. And it runs down and it attaches to the spinous processes of the cervical and the thoracic vertebra. Okay, so that's a nice stable origin. And guess what? The insertion is on the scapula. Now, the trapezius is one muscle, but we can divide it into different muscle fiber groups. And that's important because we can activate these different muscle fiber groups independently of each other. We have what we call an upper region of the trapezius. We have middle fibers of the trapezius, and then we have lower fibers of the trapezius. What's going to happen if the upper fibers contract? It's going to pull on the scapula, and which way is it going to pull? It's going to pull up. So that's elevation of the scapula, are those upper fibers, elevation of the scapula. What about these lower fibers? Depression of the scapula. And what about those middle fibers there? That's So if going forward is protraction of the shoulders, going backwards is retraction of the shoulders. Also called, we can also call this a deduction of the scapula. Okay, so all these scapular movements up, down, and inward, those are trapezius. Let's flip this guy around. Now we're going to move on to muscles that cross the shoulder joint. And remember, the shoulder joint is a ball and socket joint, so it can do all sorts of different movements. So we're going to see all different types of movements with these muscles. First of all, we have this superficial muscle right here in the, we have this superficial muscle of the upper chest. And what do we call this superficial muscle of the upper chest that I'm referring to? These are your pecs, but specifically it's the pectoralis major. And guess what? The pectoralis minor is right underneath it. The origin for the pectoralis major is going to be the clavicle and the sternum, but where's the insertion going to be for the pec major? What bone is that going to insert on? The humerus. Okay. So one of the main jobs of the pectoralis major is going to be a motion that we call horizontal flexion. So the pec major is outstretched right here. It's attached to the humerus. It's crossing the shoulder joint. So what's that pec major going to do when it contracts? That's called horizontal flexion. Okay. Brings those arms inward. Another shoulder joint muscle is this right here, superficial muscle, wraps over the shoulder. What do we call this guy here? That's the deltoid. And again, there's different muscle fiber groups in the deltoid. If we contract them all at the same time, I suppose it just stabilizes and contracts and doesn't cause movement. But what happens if we contract the anterior fibers of the deltoid? So again, the insertion is on the humerus. The anterior fibers, they're going to contract. And this is a shoulder joint motion. What motion is that? Shoulder flexion. We're decreasing the angle. What about if so that's shoulder flexion. What about if the back fibers contract? Shoulder extension. And what about if the middle fibers of the deltoid contract? It moves the arm away. What do we call that movement? Arm or shoulder, where it moves away from the midline. AB. AB is in boy. Abduction. AB, abduction, like you're taking away, you're abducting something. Okay, you're taking it away. Good. And then another shoulder muscle. Again, this is a large muscle of the back. We have the trapezius right here, but then running laterally and a little superficial to it, we have this huge back muscle that runs into this fascia here, the thoracolumbar fascia, and it attaches to the hip. But then this large back muscle runs up, and again, it attaches to the humerus. It attaches to the back side of the humerus. And so what's going to happen when, well, first of all, what is this muscle? Latissimus dorsi. So what's going to happen when this back muscle contracts? Boom. What do we call that motion? That's shoulder extension. Okay. Flexion and extension run in the sagittal plane here. And so that's a powerful prime mover of shoulder extension. And that's why swimmers, especially butterfly people, have these huge lats, that come down like so, because they're doing these powerful strokes like that, those powerful shoulder extension muscles. Okay. All right, rotator cuff muscles. There's 3 rotator cuff muscles that I want to look at. And we'll go ahead and maybe just look at this arm right here. So this is an anterior view. This is the scapula. This is the spine of the scapula. And we have this muscle above the spine of the scapula. What is that called? That's the supraspinatus, above the spine. Then we have a muscle below it, below the spine. What do we call that? That's the infraspinatus, below. And then we have this muscle on the other side, on the anterior side of the scapula. That's the subscapularis. And those are called the rotator cuff muscles. And does anybody know they have specific actions that they do, but do you know kind of the main job of these rotator cuff muscles? They are involved in actions, but one of their main jobs, and the reason you want to work on these and keep them tight, is because it keeps the head of the humerus in the socket of the scapula. Okay? If those muscles are weak or one of them stronger than the other, it can pull on the head of the humerus one way or another, and that can lead to some pinching in that area. Okay. Yeah, then subscapularis, as far as actions are concerned, subscapularis is involved with medial rotation of the arm. The infraspinatus is involved with lateral rotation of the arm. So if you want to strengthen these, and especially that infraspinatus, you can do something with cables where you move those weights out like so. Those are good to strengthen those rotator cuff muscles. And then the supraspinatus, it's not a prime mover, but it does initiate abduction of the arm. Everybody ready? Okay. All right, so today what I want to do is demo some skeletal muscles of the body. And I want to start with the head, and let's look at some skeletal muscles of the head that result in facial expression. These are muscles that are involved in facial expression. Okay. So first of all, we have this circular layer of skeletal muscle that wraps around the eye. And that muscle is called the orbicularis oculi. What does orbicularis refer to? Circular. Orbicularis means circular, like an orb. What is oculi referring to? Oculi is referring to the eye. So this is a circular band of skeletal muscle that wraps around the eye. And circular bands of muscle are what we call sphincters. We see a lot of sphincters in the digestive tract and stuff like that. Those are smooth muscle sphincters. This is a skeletal muscle sphincter. But what does a sphincter do when it contracts? It closes. So what is the action going to be of the orbicularis oculi? You're going to close your eyes. Okay, orbicularis oris is responsible for closing your eyes. Good. Then we have another band of skeletal muscle that wraps around the mouth. And we call that the orbicularis oris. Oris referring to the mouth. And what action does contraction of the orbicularis oris do? You guys can tell me, but why don't you just go ahead and do it? Puckers your lips, protrudes the lips. There you go. Well, that's even a little buccinator there. You were getting those cheeks sucked in. But orbicularis oris is going to protrude and compress the lips, like so. Okay. Then we have another muscle here called the zygomaticus major. And where is the origin for the zygomaticus major? What is the origin for the zygomaticus major?
Zygomatic bone.
The zygomatic bone, your cheekbone right up here. And the insertion is right down on the lateral sides of your mouth, the skin on the lateral sides of your mouth. So when this muscle contracts, the origin's going to stay in the same place, the cheekbone's going to stay in the same place, but it's going to pull on that insertion. So what action does that result in? Smiling. Okay, it pulls the lateral corners of your mouth up towards the zygomatic bone. Okay, so that results in smiling. This next muscle is a head muscle, but it's not a facial expression muscle. It has a different function. And this right here is the superficial masseter. Superficial meaning towards the outside, which implies that there's a deep masseter. And in fact, there is a deep masseter. And where is the origin for the superficial masseter? It's also on the zygomatic bone. Okay, and the origin stays stationary. Where's the insertion point?
Mandible.
On the mandible. Okay, on your jaw. So what's going to happen when the superficial masseter contracts? It's going to elevate the mandible. Okay, so this is involved in chewing. This is a muscle of what we call mastication. Good. All right, and then there's just one muscle I want to talk about with regards to the neck, and that's called the sternocleidomastoid. And this is the sternocleidomastoid right there. You have one running down both sides of your neck. Okay. And often the name of the muscle will tell us some things about the muscle. So sternocleidomastoid. In this case, it's telling us about the origins and the insertions of this muscle. And the origins are going to be named first. So sternocleido. What does sterno refer to? The sternum. Good. Oh, there goes an arm. So one of the origin points is on the sternum. What about cleido? Cleido's the clavicle. So the two origins are on the sternum and the clavicle. Sternocleido. What about mastoid? And this should ring a bell from when we talked about the skeletal system. Right behind the ear, if you palpate behind the ear, there's a large bump. And that's part of the temporal bone. It's a bone marking on the temporal bone. Does anybody remember what that bone marking is called? Mastoid process. Okay. So the insertion is on the mastoid process, sternocleidomastoid. And what's going to happen if the sternocleidomastoid on my right side of the body contracts? And keep in mind that muscles pull, they don't push. So what's going to happen if the sternocleidomastoid on the right side of my neck contracts? It's going to cause lateral flexion on that side of the neck. So it contracts, the muscle shortens, and it pulls the insertion, the mastoid process, towards the origin.